So planks can be a great way to get someone out of low back pain unless it's directly contributing to their back pain. A lot of times we prescribe planks in an effort to get people out of low back pain, but it turns into a game of how long can you hold it, form doesn't really matter, breathing doesn't really matter, and then we start to strengthen the dysfunction. So in this video, I want to talk about why we should start to incorporate a foam roller into our planks so that you can really maximize the efforts and ultimately just set your patient up in a position for success during their plank. The foam roller is really going to help to be a reference point, and it's going to allow your patient or client to better understand how to move their pelvis as well as their upper extremity. Now, the first thing that you can really beneficially use with the foam roller is to help your patient or client understand how to tip their pelvis posteriorly. Normally, we are fighting more of an extension pattern when we're implementing a plank. However, if it's someone that's actually overflexed in more of a rounded posture, you can use this to anteriorly tip the pelvis. But generally speaking, you are going to want to go into more of a posterior pelvic tilt when performing a plank, and the foam roller is going to allow them to do that. It does that by helping roll the pelvis because the foam roller is actually going to roll underneath their legs, giving them that leverage and reference point. Now, when it comes to the upper extremity, when your patient or client is on the foam roller doing their plank, their position is slightly higher at the hips. This is going to offset the upper extremity and set it in a position that's a little bit lower. That's what's going to give them the reference to really protract and bring that sternum up without losing any height, right? That means true protraction and not going into a crunch or more of this forward flex position. This is going to help posteriorly orient the ribs, which is going to be necessary and required with a good posterior pelvic tilt. So now that your patient understands how to protract and tilt the pelvis in the right direction, then you want to start to change your reps for breaths. A lot of times this turns into a really long hold when in reality, if your patient or client is doing it correctly, they probably shouldn't be able to do it for that long. So encourage them to switch the endurance base for more respiration base. This is going to help to change the overall structure and to help move them in positions that they're not normally in. So I hope you found that valuable. Next time you're doing a plank, substitute the normal plank and implement the foam roller. Really use it as a good reference point to better understand the pelvis and the upper extremity relationship, and then start encouraging your patient to focus on breathing more compared to the time aspect.